Theater. Today I'm going to teach you hyperthyroidism and hypothyroidism. These are abnormalities of the thyroid gland, and we are going to go through them. David7sanstheater@gmail.com. Contact us for more information. Consult, contact, consult. Okay, let's continue. So that is it, David7sanstheater, and don't forget to like us, subscribe for more and better videos, and share to fellow students to also enjoy. Alright, hyperthyroidism, we are starting with that. You can look at this man. He has an abnormality. It's bulging out of these eyes here. Yes, the eyes bulged out. Okay, you can see. So, thalmos, that's how we call it. And hyperthyroidism refers to increased secretion of thyroid hormones. And its common causes are two. Which one is Graves' disease, and the other one is toxic nodular goiter. Alright, so let's start by talking about Graves' disease. Okay, Graves' disease, or what they call toxic goiter, or you can call it thyrotoxicosis, is an autoimmune disease characterized by the development of thyroid-stimulating antibodies. These antibodies stimulate the thyroid gland, and they are against the TSH receptors, also called long-acting thyroid stimulator. So they develop antibodies which stimulate the thyroid gland. Okay, they are called long-acting thyroid stimulator. In this disease, it is an autoimmune disease. These antibodies bind to TSH receptors of thyroid stimulating hormone, and mimic actions of this hormone TSH on thyroid growth and hormone synthesis. Therefore, the entire thyroid gland undergoes hyperplasia as a result of autoimmune stimulation. The entire gland undergoes hyperplasia. So due to hyperplasia, we are having more number of cells, means the colloid secreted will increase and the hormone synthesized will also increase, cause what we call thyrotoxicosis, or call it Graves' disease. So the investigations of Graves' disease. 1. The levels of thyronins in plasma will be elevated. Both T3 and T4, the levels are elevated in plasma. But thyroid stimulating hormone is low or may become undetectable. Okay, because these hormones, through negative feedback inhibition, have to reduce TSH synthesis and release. Okay, if you see radioactive iodine uptake, it is increased, i.e. greater than 35% at 5 hours. So iodine is being trapped at a faster rate because there is a high demand due to hyperplasia of the gland. And TRS antibodies may be increased, okay, greater than 7 U per 1. Okay, you can see this, and the normal should be this, but if it is greater, it means these antibodies are increased. Serum cholesterol is less. Okay, another investigation they find is that the ECG will show tachycardia and arrhythmias. Okay, arrhythmias and tachycardia. All right. Ultrasonography of the thyroid gland shows diffuse goiter. If it is if they are nodules, it is called a nodular toxic goiter. So this is diffuse. Diffuse goiter represents Graves' disease. Okay. General features of Graves' disease. It has several features, but generally you'll find that there is a marked increase in basal metabolic rate because the thyroid hormones are regulating BMR, When they are high, it is high. Okay. Weight loss, despite an increased intake of food, and increased heat production, which causes discomfort in warm environments. All right, due to high levels of thyroid hormones. Another general feature is that there is excessive sweating and a greater intake of water. Okay, water is highly lost in evaporation as heat rises, so thirst centers activated when cells get dehydrated, and so there is excessive intake of water. All right, other signs and symptoms of Graves' disease, we have goiter, the swelling of thyroid gland. This disease is characterized by diffuse goiter, while single or monodules indicate toxic nodular goiter. These I've talked about it. Another sign and symptom is that there are cardiovascular features that you find. For example, you have increased pulse rate, sinus tachycardia, and arrhythmias. Usually the atrial fibrillation, okay, of the atrium. That is the commonest arrhythmia you will find. There are neuromasticular features, for example, nervousness, irritability, restlessness, psychosis, tremors of the hand, muscular weakness, and exaggerated tendon reflexes. All these are neuromuscular features you'll find in Graves' disease. Let's continue. There are others. Gastrointestinal features are diarrhea and steatorrhea and vomiting. Okay, steatorrhea, vomiting, and diarrhea. All three are gastrointestinal features of Graves' disease. Dermatological features are perspiration, that is increased sweating or what we call hyperhidrosis, loss of hair, and redness of the palms. That is, those are also signs of Graves' disease. Let's continue. Reproductive features are impotence in males and oligomenorrhea or amenorrhea, abortions, and infertility in females. These are reproductive features of Graves' disease. Oligomenorrhea, amenorrhea, abortions, and infertility in females. Right. Ophthalmological features or signs are lid retraction. The lid is retracted, like in the first pic we saw on the first page. The lid is retracted, producing a staring look. And lid lag occurs and the exophthalmos bulging out of the eyes. Okay, let's continue. So that has been hyperthyroidism. I want to take you to hypothyroidism and see what is happening here. First, this is a clinical syndrome caused by low levels of circulating thyroid hormones. Okay, and it can be primary or secondary. When is it primary? It is primary if it is caused by a disorder of the very gland, thyroid gland. It is secondary if the disorder is in the adrenal hypophysis or it is in the hypothalamus and not in the thyroid gland. Okay, that is when it is secondary. And the investigations of hypothyroidism we can find, you'll see that the serum T3 and T4 levels are low. Hypothyroidism this time around. The serum TSH levels are high due to reduced negative feedback inhibition, and low, that is in primary, and low in secondary. Secondary, that is caused by there's a defect in the adrenal hypophysis or hypothalamus, so TSH should be low. But in primary, it will be high due to reduced negative feedback inhibition. And investigations of hypothyroidism itself. Serum cholesterol will be high, okay? Peripheral blood film macrocytic anemia. Yeah, you know this. Peripheral blood film macrocytic anemia. The cells are large, yes, in anemia. This anemia is macrocytic anemia. We saw that in anemia when we were talking about anemia in our recent video. All right. Photomotogram shows delayed ankle jack. Okay, photomotogram shows a delayed ankle jack in hypothyroidism. Photomotogram will show delayed ankle jack. All right, let's continue. Clinical features of hypothyroidism. Depending upon the age at which deficiency manifests, duration and severity of the disease, there are two different clinical entities in hypothyroidism. We have hypothyroidism of the infants, call it cretinism, all right? And we also have hypothyroidism in adults, we call it myxoedema. So these are two clinical entities depending on deficiency, age at which deficiency will manifest, duration or severity of the disease. So we're starting with talking about infantile, and if you can see this person here, this one is having myxoedema, but this one is having cretinic. So this is suffering from cretinism. It occurred in the infant. This one, myxoedema, task tissue, you can see fat in the cheeks, pitting edema, non-pitting edema, pitting edema. So anything, you can see there's edema. This person here is adult hypothyroidism causing this. This is infantile hypothyroidism. So we're starting with cretinism. Cretinism, there is thyroid deficiency in the infantile life or first year of life, and is characterized by mental retardation, marked retardation of growth, delayed milestones of development, a pot belly, protruding tongue, flat nose, dry skin, and sparse areas. So all these are characteristics of the cretinism, infantile hypothyroidism. And to add on, the radiograph of bone will show delayed bone age. Bone age is lower than the age, okay? At adolescence, those guys of cretinism will be short in stature, will perform poorly at schools, and there's delayed puberty and sexual maturation, right? Penis too small. Let's continue. Myxoedema now. This is adult hypothyroidism. And in adult hypothyroidism, there is characteristic infiltration of skin by myxoedematous tissue. This myxoedematous tissue infiltrates or penetrates through the skin, and the signs and symptoms are here. 1. There are general features like tardiness and weight gain without an appreciable increase in caloric intake or calorie intake due to lower than normal levels of metabolism. So these guys tend to gain a lot of weight because even if they don't take a lot of calories, this is due to lower than normal metabolic rate, and they're tired. 2. There are general features like another sign and symptom is decreased heat production. Yes, due to lower than normal metabolic rate, lower body temperature, which causes intolerance to cold and decreased sweating. When the temperature is low, these people cannot tolerate coldness, and there is decreased sweating. Okay, all these are signs and symptoms of myxoedema, and there are also cardiovascular features. For example, adrenergic activity will be decreased, and this will cause bradycardia. All right. There are neuromastical features. Movement, speech, and thought are all slowed, and the lethargy, sleepiness, delayed relaxation of ankle jacks. They delay to relax. The other one was delayed to be seen. So here we have delayed to relax. Ankle jacks, delayed to relax. Aches and pain are common. All these are neuromuscular features of adult hypothyroidism, call it myxoedema. The pressure pulse of peripheral nerves, for example, carpal tunnel syndrome, due to entrapment in excessive ground substance. Low metabolic rate, ground substance increases pressure pulse of peripheral nerves, gaining weight, with an appreciable food intake. Entrapment of these nerves will occur. And for example, they can encounter or get carpal tunnel syndrome. Okay? And dermatological features will be dry skin, call it toad skin. It is dry and thick. The hair will be sparse, non-pitting edema due to infiltration by myxoedematous tissue. So all these are characteristics of myxoedema. When they ask for any, you have to give several or a couple of them. There are many. You cannot stop talking about them. Delayed relaxation of ankle jacks, lethargy, sleepiness, speech and thoughts are all slowed. The movement is slowed. All right. So another feature are reproductive features. This will include menorrhagia and infertility. Infertility is common. Galactorrhea and impotence are less common, but they occur. Okay. Features of the GIT will be constipation. This is common, and the dynamic ileus. This is less common. Okay. Hematological feature include anemia. Anemia will occur. Hematological feature anemia in people with adult hypothyroidism. So I just urge you not to forget to subscribe for more and better videos. You like our videos, you click that button for more for notifications. We always upload videos, and share to other students to also enjoy the videos.